Hello, I'm Dr. Sharon Norling. Ask your doctor on the Asheville View. My background is I'm OB/GYN board certified, and my specialty is hormones. I get asked the question all the time, when should a woman in the premenopausal phase actually go to her doctor and get more information about her hormones? Well, this is a huge transition when women go from being premenopausal to menopause, but also when they go from normal hormone replacement therapy to the premenopause. Now, there's lots of stuff that go on during this period of time in her life as well, because there's a lot of stress. There's stress with the work, there's stress with the children, there's stress with the husband, there's stress not having a husband, there's stress with the boyfriend. It's not having a boyfriend is stressful, or having both, a husband and a boyfriend. So there's lots of stress that goes on during this period of time. And I kind of describe this period as sort of the rocky road to menopause. I think that's a topic for a great book. And the first chapter would be, you wake up sweating. You know, you've heard the stories about hot flashes in the menopause, but it's true for men too. If their testosterone is getting lower, they will wake up in the middle of the night with night sweats as well. Then you can't sleep. You know, you get the insomnia, and then all of a sudden your periods are very erratic. Women will say, well, what can I expect? I'll tell you what you can expect. You can expect your periods to be shorter or longer. They can be further apart or closer together. They can be heavier or they can be lighter. So they always say, well, thank you, Dr. Norling, that's very helpful information. Of course, it varies. And so whatever you can expect is what's going to happen to you during your premenopausal phase. This is something that is kind of a common thread that I hear in my office, and I'm not saying any of you men out there in the audience ever fit this category. But a premenopausal woman will spontaneously say to me, my husband is getting stupid. Now, that may not be true, but at least that's their perspective. And I think the other thing that happens is that your patience disappears. Okay, you used to be very patient, but you've been taking care of all these people all your life, and you've been kind of the person who gets the job done, you're very nice, and finally, you know what, you're done. You're done. So people, the public, but also men will say, oh, she doesn't have any patience anymore, she's going through the menopause. I don't think it's just the menopause and the hormonal shift. I think they're just done, and they want more participation in all the multitude of activities that they've been doing all their life. And you kind of get a whole definition of mood swings. One of the key things, and this is true in menopause, andropause, premenopausal, is that you begin to forget things. So what happens is that you're walking into a room, you're going to get something done, and you get there and you think, what am I doing here? That's not Alzheimer's. That's just hormonal shifts, and I think the stress in our lives. I had a personal experience with that. I was at the University of Minnesota teaching, and I was a keynote speaker to a 5-state health, program filled with physicians, and from North Dakota, South Dakota, Iowa, Wisconsin, and Minnesota. So I'm standing in the Mayo Auditorium, getting ready to do my keynote. I'm up at the podium, and I say, I'm going to talk about 3 things. The first one is this, and as soon as I started to say the second one, I had no clue what the third point was. So I said, and the second point is, and then the third point, I looked out at the audience, and I said, the third point is, 24 answers came up, and I said, that's it. Well, I went on and gave the talk, and then I finally figured it out. But it's not uncommon that that happens. It's called the brain fog, and the hormonal shifts that go through this period of time can be very dramatic. But I think it's important to separate fact from fiction. And the menopause has a wide range of symptoms. It can be vaginal dryness, it can be decreased libido, hot flashes, it can be all sorts of things, joint pain, difficulty sleeping, weight gain, swelling, skin changes. The list goes on and on and on. We can also have days where we're just having a really bad hair day. So it's important for you to be able to get to a doctor who understands about the appropriate life-changing and life-saving hormonal replacement therapy. So you get the individual dose specifically for yourself. So when you have a bad hair day, you realize that the only solution for that is to wear a low-cut blouse. So, you know, as a menopausal woman, premenopausal woman, you deserve the best care. You deserve to live your best life. And this is Dr. Sharon Norling with Ask Your Doctor on the Asheville View.